a few ways to inject filler, and oftentimes I will use a combination of a needle as well as a cannula. I might go to a cannula when there's an event coming up tomorrow and you're in getting your filler today, because cannulas have a less of a chance to cause bruising. Also, sometimes when you have red hair especially, those patients are a little bit more prone to bruising, or if you are on blood thinners, etc., I will often choose a cannula for those types of treatments. But sometimes I'll do, like I said in the beginning, a combination of needle and cannula, because there are some areas that you just really want to go right down to bone on, and that's a lot easier to accomplish by using a needle, because that will really help lift the skin up, kind of like scaffolding of a house, and then you can go over that area with a cannula to smooth things out. So it really just depends on the patient. It depends on things that are going on within the next few days to week, and also, timing, and also how nervous are you? If you're nervous, usually the cannula is the way to go. It's a lot more comfortable because we're only using one spot of lidocaine, and we can go back and forth and keep filling. If we need to go back again, it's easy to go back in through the same spot. So when people are nervous, I love to use a cannula. Oh, there is one other time that I always use cannula, and that is doing tear trough filler, because I do not like using a needle going down to bone multiple times in this area. So I will use a cannula all the time here. Another frequent place to use a cannula would be for nasolabial fold filling. There is a facial artery that zigzags down here, and it's pretty unpredictable to know where that artery is unless you have one of those little machines that shows you where the artery is. So using a cannula really helps increase safety, because there is a risk when using a needle that you will get the filler into an artery. And if you do that, or if the provider does that, that could be a problem. Cannula, when you go in through with the cannula, and if you were to go by an artery, it usually pushes the artery aside as opposed to piercing the artery. So there's a lot less likelihood for the filler to get into an artery, therefore increasing the safety benefits of that. So because this artery is zigzaggy, for a very professional word, I love to use a cannula here because I know I'm not going to get it in the artery, knock on wood. So lots of different factors between needles and cannula. Your provider will most likely use a combination, but ask them why they're using a cannula, and ask them why they're using the needle. Ooh, another really good reason to use the cannula is because it will actually help you increase collagen formation, because as I glide through your skin, you can feel that cannula irritating the cells that I'm gliding by, and I say gliding loosely, but that's irritating the cells that make collagen. So then those cells go into fight or flight mode. They can't go anywhere because they're stuck in your skin, so they fight back by making collagen simply by doing this procedure with a cannula. They don't get as much irritation when you're using a needle. So safety benefits for cannula, ease for your injector, as well as ease for you. Ease for your injector because I'm not as worried about occlusion, ease for you because you don't have as much discomfort, and decreases the risk of bruising significantly.